Fibroids are among the commonest pelvic tumors that women have. It is estimated that 30% of women over 30 years of age would probably have fibroids, and by the age of 50, that is around menopause, almost 70% of women probably would have fibroids. Fibroids are categorized into different categories, and according to FIGO, it's categorized from 0 to 7, so 8 different categories, 0, 1 and 2 types of submucous fibroids, depending on how much they are protruding inside the cavity of the womb. Type 3 and 4 are intramural fibroids within the muscles of the womb. Type 5 and 6 are subserous fibroids, depending on how much they are protruding outside the surface of the womb. And type 7 is pedunculated fibroids, completely outside on a stalk. There are also parasitic fibroids and cervical fibroids. The association between fibroids and infertility is fraught with controversies at the moment, partly because there has been very few, if any, randomized controlled trials. It is seen that paras women who have had children, the incidence of fibroids overall is less as opposed to women who have never had children. However, the causal effect, whether fibroids have anything to do with fertility or lack of fertility, is controversial. The association between presence of fibroids and women seeking fertility treatment is about 10 to 15%, and fibroids being the sole possible cause or possible association is about 2 to 3% only. It is thought of that fibroids may affect fertility by anatomical distortion, mainly distortion of the cavity of the womb, particularly the submucous variety, or occasionally being close to the tubes. It can also cause functional disturbance. It can cause disturbances in the functioning of the endometrium, the lining of the womb, functioning of the myometrium, the muscles of the womb, the peristalsis or the uterine contractions may vary, the blood flow may change, and the hormonal milieu may change, thereby affecting the movements of the gametes, that is the sperm or the eggs or the embryos. At the end of it, at present, it's the position of the fibroids, the location and the size of the fibroids that probably ultimately has significance with regards to its clinical picture and its treatment. Fibroids and implantation, particularly in view of assisted reproduction. There have been meta-analysis and systemic reviews that have shown that, particularly for submucous fibroids and to a lesser extent with intramural fibroids, there is association between the presence of them and a negative impact on clinical pregnancy rate, ongoing pregnancy rate and live birth rate, and miscarriage rate. However, the controversy remains that intramural fibroids that do not distort the cavity, whether they affect fertility and assisted reproduction outcomes. As I said before, even though observational studies do suggest so, there has been no randomized controlled trial to confirm this. With regards to miscarriage, again, there is no randomized controlled trial, but with reviews and retrospective and some prospective observational data suggests that there may be some association. A review between 1957 and 1980 showed that myomectomy increases the pregnancy rate from 20% to 40%, or decreases the miscarriage rate rather from 40% to 20%. Another observational study of about 140 patients showed that presence of multiple fibroids as opposed to a single fibroid possibly increases or almost doubles the miscarriage rate in the first trimester. Whether treatment, myomectomy, helps increase the pregnancy rate in general fertility, natural fertility, a review between 1933 and 1980 by Bertram and Reiter did show that myomectomy does increase the pregnancy rate by about 40%, and a similar review later on, more recently by Bersolini, confirmed similar findings. Laparoscopic or hysteroscopic myomectomy as opposed to open myomectomy so far has not shown any significant improvement or change in the data. Myomectomy in many cases, its data suggests that may help with clinical pregnancy rate, and a hysteroscopic myomectomy does not have a negative impact on implantation or fertility in assisted reproduction according to recent data. With regards to intramural fibroids and subserous fibroids, there has been an observational study that suggests that any fibroid over 5 centimeter, even with intramural and submucous fibroid, intramural and subserous fibroids, removing them may have a positive impact on assisted reproduction. With regards to non-surgical management of fibroids, the treatments that are commonly employed are GnRH analogs. GnRH analogs are generally used preoperatively for about 3 months or so, and they induce a pseudomenopause-like state or a menopause-like state. However, from a fertility point of view, they obviously, by downregulating all the hormones, will not help fertility as such. More recently, selective progesterone receptor modulator or irinotecan is used, again mostly preoperatively or sometimes in elderly women close to menopause for 4 cycles. However, there is recent controversy about more serious side effects, and in any case they are not recommended for fertility patients when one is trying to conceive. Magnetic resonance guided high intensity ultrasound, focused ultrasound, and gene therapy are more recent therapies. However, there is very limited evidence on fertility issues. Uterine artery embolization, however, is increasing in its application for non-surgical treatment of fibroids, and there has been studies that has shown that it does have some negative effects on fertility. There has been a retrospective study that shows that it has some negative effect on clinical pregnancy rate, increased miscarriage rate, increased preterm labor, increased cesarean section rate and postpartum hemorrhage. Also, hysteroscopic evaluation of the cavity after uterine artery embolization has shown adhesions, myomas protruding inside the cavity, necrotic tissue, and myometrial fistula. And studies have shown that the monthly fecundity is reduced after uterine artery embolization to 0.1%, even though ovarian reserve is not. So there are some concerns that uterine artery embolization may affect fertility in a negative way. Thank you.